You can tell ant control products are working when you see a steady decline in ant activity around bait stations and entry points. Start by establishing a baseline of ant activity for at least 2 days before treatment by noting number of ants at bait stations, trails, and inside the home at consistent times of day. Use bait stations with slow-acting toxicants when targeting worker-forager transmission to the nest, and place them along active trails and near entry points, but out of reach of children and pets. Check bait stations daily for the first week, and then every third day for up to 3 weeks. A declining bait uptake and fewer ants at stations over days indicates successful transfer to the colony. Use non-repellent residual sprays only when you need perimeter protection because repellents can push foragers inside and confound monitoring. Record observations in a simple log with date, time, location, and approximate count, or descriptive terms such as many, some, or none to objectively track trends. If counts are unchanged after 7 to 10 days, switch bait formulations with a different active ingredient and relocate stations slightly to intersect different foraging routes. The most common mistake is assuming a sudden drop in visible ants means the colony is eliminated rather than temporarily avoiding treated areas. Keep checking bait activity and interior sightings for at least 3 weeks. Another issue is using repellent products near baits, which causes foragers to avoid treated areas and masks true bait effectiveness. Avoid applying repellents adjacent to bait stations and use them only for perimeter gaps in a planned sequence. A third concern is failing to record consistent monitoring data, which makes it impossible to judge progress. Use a simple log and take a photo or two of bait stations and high-activity spots on set days so comparisons are objective. BigHomeProjects.com connects this monitoring approach to real-world help by letting homeowners find local contractors who can advise on bait selection, placement, and follow-up treatments. We also help contractors find work and engage with a discussion community where we share experiences, ask questions, and compare practical monitoring tips.